Your doctor doesn't want to know about your anxiety. And I'm not suggesting that doctors don't care. I'm saying that your emotional health is not their concern. However, the reason for this might surprise you. There can be a number of reasons why our first port of call when we're experiencing high levels of anxiety is our local general practitioner, not least of which is that often anxiety comes with certain physical sensations that we might want to get checked out to make sure they don't indicate something serious medically. But if you've ever gone to the doctor about your anxiety only to leave feeling confused or even dismissed, there's probably a good reason for that. It's not because they don't care about you, it's because anxiety is by and large nothing to do with them. I'm Tim Box, mind coach, remedial hypnotist and anxiety therapist. For more than a decade now, I've been working one-to-one with clients, both online and face-to-face, to help them get the other side of their anxiety issues. And one thing I hear a lot from clients is something like, I went to my doctor about my anxiety and they really weren't much help. Now, this can feel a little bit disappointing, like we've hit a dead end. But here's what I want to talk about today. That reaction from your doctor, that isn't unusual and it isn't personal. In fact, it makes perfect sense. Now, doctors are brilliant. I want to start by making that absolutely clear. Any doctor you see for any issue has had years of training and maybe even longer seeing patients face to face. They know their stuff and we shouldn't dismiss it when they give us the benefit of their knowledge. As a side note here, if we're experiencing health anxiety, we do that all the time. We experience certain physical symptoms, and if the doctor seems unfazed or tells us it's nothing to worry about without actually doing a series of in-depth tests, then we assume they haven't taken the matter seriously or they just don't know their stuff. Yeah, that's a mistake. Your doctor is highly skilled, extremely knowledgeable, and has a greater deal of understanding about what's potentially wrong with you than you do. Doctors have quite literally saved my life before, and they'll probably save it again one day. I'm a huge fan of doctors. But here's the uncomfortable truth. Your doctor doesn't really want to see you about your anxiety. And I don't say that to be harsh. I say it because anxiety is not their area of expertise. In fact, anything to do with your emotional well-being is outside of their field of expertise. They've had about as much training in that as your average plumber. What they've trained in is medicine. They deal with physical health. And anxiety, contrary to popular belief, is not a medical problem. There are three main reasons your GP might not be the best place to go when struggling with anxiety. Firstly, they get about 10 or 11 minutes with you. That's it. In that time, you have to explain how you feel, why you feel that way, and what you want to do about it, assuming you even know what that is yet. That's just not enough time for anybody to fully understand your emotional landscape. Doctors are trained to reduce each interaction into a diagnostic process and to do this as quickly as possible. When it's anxiety we're dealing with, we need space and time to be heard and understood on a level that simply isn't available to your local doctor. It's just not fair to expect them to have an answer for you in that time. Secondly, your doctor has very limited options in terms of what they can offer you. They can either give you medication or refer you for some type of therapy or counselling. Now, I won't do a deep dive into the pros and cons of medicating our emotions in this video, but suffice it to say, whilst meds can help you through difficult times, they won't solve the issue. And the counselling referral, well, that usually comes with a waiting list that could stretch for months, maybe even years. Don't get me wrong, therapy is often the answer, but probably not when you have to wait 12 to 18 months for it. You'll need to seek out someone private, and your doctor is not in a position to recommend or refer in that way. By the way, if you're interested in what good one-to-one therapy looks like, then stay tuned to the end of this video, as there'll be a video you can click on that tells you a little more about how I work with my clients. The third reason doctors are not well positioned to deal with anxiety issues is the one we've already mentioned. They're simply not trained in that area. If a doctor wants to become a specialist in mental or emotional health issues, then they need to train for about 5 or 6 more years to become a psychiatrist. And even then, they'll still be tied to that medical model of anxiety, and viewing things this way can often do more harm than good. This is why when I've had doctors as clients, they'll make it very clear that anxiety falls outside of their remit. And some have told me they actually feel anxious when someone comes to them with anxiety because they know they're not really equipped to help in the way that person needs. I might have been doing this job for nearly 15 years, but I never trained medically. And a big reason for this is because the medical model comes with a huge set of limitations when it comes to managing or improving our emotional well-being. Many people I work with have been stuck with the same set of anxiety responses for years, not because their anxiety is untreatable, but because they believed they were ill. The medical model had a certain way of explaining this for them. They went to the doctor, they got labelled with a disorder, maybe they were even given meds, and from that point on, they saw their anxiety as a medical problem, an illness. But anxiety isn't a malfunction, no matter how extreme it becomes. It's a normal, healthy, albeit sometimes exaggerated, human emotion. And the turning point for so many of my clients comes when they start to see it that way. Just recently, I worked with a client who had a nursing background. As a result, he'd always viewed his anxiety as a medical issue. But when we got to our third and final session, and he was the other side of all that high anxiety and those physical sensations that troubled him, he said something I'll never forget. He told me that discovering anxiety was just an emotion, not an illness, was not only the key to his recovery, he actually said it felt like he was breathing new air. And that's it. That shift in perspective can change everything. Now, I am not saying throw your medication away. Let's be really clear about that. Nobody should ever alter medication a doctor has prescribed for them without consulting with that doctor first. And after all, medication can absolutely help. It can offer comfort, calm, and a sense of stability while you do the deeper work. But don't go to your GP expecting to be fixed because you're not broken. And don't go there expecting a cure because you're not ill. You're just having a completely understandable emotional response to life's challenges, one that you can change. Here's something else to keep in mind. When you go to the doctor with physical sensations like tightness in your chest, lightheadedness, palpitations, stomach issues, nausea, and any other number of potential uncomfortable symptoms, they will definitely run tests to check for any medical ailment. Then, of course, in the vast majority of instances, those tests will come back negative. In that case, the doctor might tell you that these sensations are probably caused by anxiety. Please understand that they are not saying you've tested positive for anxiety. They're telling you you've tested negative for everything. It's their way of saying there's no illness here. It's their way of telling you that what's going on now falls outside of their remit and expertise, because it turns out this is an emotional issue. And that means you can now do the work on your emotional well-being and get your anxiety response back under control. So when I say the doctor doesn't want to know about your anxiety, it's just in the same way that I don't want you coming to me to fix your broken arm. Remember, anxiety is not some kind of condition you're stuck with. It's just your mind creating an emotional response to try and steer you away from perceived danger and towards happiness. And when we understand that, we can change the way we respond to it. That's it for this one. Please give it a like, subscribe to the channel, and if you want hours more content and weekly live streams from me, then check out the members area in the description below. And most importantly, always remember, be kind to your mind, and I'll see you next time.